Hi, Assalamualaikum warahmatullahi wabarakatuh. Today we will be presenting a case study entitled A Study on Stress Management Strategies of Students by A. Manoj Kumar and R. Bauthra. The presenters will be Muhammad ZAKWAN bin Muhammad LUTFI, number ID SEC 21070299, and me, NURUL NAJWA BINTI BAKHTIAR, number ID SEC 21070111. So today we will talk about 6 things. Firstly, we will talk about introduction to stress. Secondly, types of stress. Thirdly, health problems related to stress. Fourth, symptoms of stress. Fifth, techniques used to manage stress. And lastly, research about stress management strategies of students that is conducted by the 2 writers of this research article. Before we go deeper into this topic, let me brief you about stress. The abstract of stress is that stress is a condition of mental pressure when some particular individuals face problems from environmental and social well-being, which leads to various diseases. So now, let us begin with introduction to stress. So, what is stress all about? Stress is an emotional or physical tension. You can feel stress when you're angry, nervous, or frustrated. In short, stress is your body's reaction to a challenge or demand. As defined by Palmer on year 1989, stress is the psychological, physiological, or behavioral response by an individual when they perceive a lack of equilibrium between the demands placed upon them and their ability to meet those demands, which over a period of time has led to various health problems. So, stress management has become one of the alternatives for people to counter this problem. So, what is the meaning of stress management? Stress management is a set of techniques or programs intended to help people deal more effectively with stress in their daily lives by analyzing their specific stressors and ways to deal with them more effectively. We will now move on to types of stress. Did you know that there are 2 types of stress? Firstly is the acute stress and secondly the chronic stress. So what is acute stress? Acute stress is a short-term stress that goes away quickly. It usually occurs when you are involved in sudden or abrupt situations that amplifies your adrenaline. As an example, you feel acute stress when you slam on the brakes, or when you tripped on a rock and about to fall, or when you are having a fight with your partner. Secondly is the chronic stress. Chronic stress is a stress that lasts for a longer period of time. It can caused by an unhappy marriage, money problems, or trouble at work. Any stress that lasts for months or weeks is defined as chronic stress.
Now we will talk about health problems related to stress. Having stress could lead to having heart disease such as heart attack. Researchers have long suspected that people with type A blood had a higher risk of having high blood pressure and heart problems. This problem is triggered from a sudden emotional stress mostly. Secondly, being overstressed could worsen asthma. A study has shown about how parental stress affect the asthma rates of young children who were also exposed to the air pollution. People who live in a stressful environment too tend to have obesity. Stress causes higher level of hormone cortisol that seem to increase the amount of fats that's deposited in the abdomen, says winner, and this leads to having diabetes as well. Stress can worsen diabetes in 2 ways. First, it increases the likelihood of bad behavior such as unhealthy eating and excessive drinking. Second, stress seems to raise the glucose level of people with type 2 diabetes directly. Stressed people will also have headaches. This is the most common health problem that people will always have. If it is not managed carefully, it can lead to having migraine, and as we know, migraine is a lot more painful than the normal headache. Depression and anxiety will also worsen. One survey of recent studies found that people who had stress related to their jobs, like demanding work with few rewards, had an 80% of developing depression. Lastly, people with stress are expected to have expedited or accelerated aging. I am sure that most people had heard from their parents that people who are always mad will become older faster. Next in line is the symptoms of stress. Firstly, moodiness. And then we have irritability. People who experience stress are easily irritated by small things. Next, we have worrying. People living in a stressful environment would worry almost about anything. And next is nervousness. Nervousness will happen too when you are too stressed out. Anxiety tics. Maybe you are wondering, what is anxiety tics? Anxiety tics is the motion happen when a muscle or group of muscles moves without you trying to move it. Lastly, getting confused easily. Some other symptoms are short temper. Short temper, these two often happen to stressed people. They tend to scold people without taking into account about their feelings. Next, we have restlessness because of overthinking and worsened health issues. Accelerated speech or any speech problems also happen to people with anxiety. Finally, lack of confidence or low self-esteem. These are the techniques used to combat stress. Yoga and meditation. The older generation mostly will do this to calm their mind, while the younger generation loves to do physical exercise to release stress. There are people who think that they have to manage their time wisely too. Most people would indulge themselves in entertainment, for example, watching movies and playing games. Some others would just sit and do a positive thinking to combat their stress. And then we have people who would just sleep to release their stress. Taking medications. People with depression, anxiety or other health problems are advised to take medications. Some other people would even pray to their own God. Lastly, playing with pet animals. For instance, cats and dogs. These animals can calm stressed people in their own way.
Next, we will talk about research. This research study is a descriptive study and the data was collected from students using questionnaire. The variables used for this research are socio-demographic variables, reasons for stress, and the strategies used by students to cope with stress. For this research, we will brief you about the profile of the respondent, type of difficulty in the studies, symptoms of stress, coping strategies, and lastly, conclusion. From the table, we can identify that 85.5% of the respondents are in between the age of 20 to 25, 90% of the respondents are pursuing post-graduation, and 75.5% of the respondents are having nuclear family. As you may ask, what is nuclear family? Nuclear family is a family that has dependent members or children. As you can see from the pie chart, school or college is the biggest contributor to cause of stress among respondents with a percentage of 31.8, while community is the least contributor to cause of stress among respondents with a percentage of 10. Moving on to the type of difficulty in the studies. From the table and the pie chart, we can see that 27.3% of the respondents experience stress from group behavior, 21.8% of the respondents experience stress from lack of information and lack of recognition, and 29.1% of the respondents experience stress from other reasons that are not stated in the research. Now, symptoms of stress. From the table, we can identify that the symptoms of stress most of the time are reflected by getting confused easily, and secondly, worrying. Last but not least, strategies for coping up the stress. From the table, we can see that the coping strategies used by students most of the time are entertainment, moving away from stressful environment, speaking with like-minded persons, sleep, positive thinking, time management, and browsing and exhibiting the feeling through social media. Conclusion. We can conclude that stress is the body's natural reaction to challenges. When a student experiences high level of stress or chronic stress regardless of age or grades, it can disrupt their abilities to learn, memorize, and earn good grades, as well as lead to poor physical, mental, and emotional health. Therefore, stress management among students in universities and colleges is a significant matter. This research is one of the attempts to know the impacts of stress among students and the necessity of managing it in order to make learning more effective. This is the reference that we use to present the case study of stress management. That marks the end of our presentation today. Thank you for lending your ears for listening to our presentation. Thank you and Assalamualaikum.